Hi, this is Dr. Paul Manito, your Asheville, North Carolina chiropractor. And today I have James with me. James, so tell us, what's going on with you today?
I've been having lower back pain on the right side and some pain in the back of my shoulder. And I've also got some TMJ, some jaw clicking.
Clicking?
So,
okay,
yeah.
All right. Well, first we're going to start by checking your posture.
All right.
Go ahead and stand in front of the mirror. So with your eyes closed, just nod your head a couple times, backwards and forwards. And then just stay on what feels normal or neutral. Okay. So you can open your eyes. All right. So you can see, can you see the spacing here? How this is greater and this is less. Can you see that from behind? Look at the spacing here, and the spacing here. So his whole body's translated this way, and you can see this shoulder's kind of rolled forward. Turn and face the side there, and then from the side, you can kind of see the ear should line up with the seam in the shirt here. So you can kind of see his head's about 1.5 inches forward. Mm-hmm. So that's causing a lot of extra stress here, and it can actually cause stress on the jaw too, because when the head comes forward, it tenses those jaw muscles and can cause it to come out of alignment. All right, great. So we're going to go ahead and lie face down. So the first test we're going to be doing are the leg checks. There's 3 leg checks that I do. First is going to be leg length. So I'm going to just check to see that one leg's not longer or shorter than the other. Good. Leg length looks good. The second test here is the flexion test. I'm going to bring your legs into flexion. Just relax, let me do this. And I'm measuring how far they bend. They should bend equally. Okay, just relax, please. Okay. And do you feel the difference how much looser this one is? Mm-hmm. And you look at the difference there. So you can see that's about 3 inches deficiency on the right. Do you feel tighter on this side?
Oh yeah.
Okay. The third leg check is now without bending the knee. I'm going to get you to raise the entire right leg from the hip as high as you can. Hold on. Mm-hmm. And then you're going to lower it, and then you're going to do the left one. Mm-hmm. And tell me which one feels harder or heavier to raise. Okay, so let's start with the right one. Okay. And then lower it. And now do the left one. Okay, so did the left one feel easier?
Yeah.
Yeah.
Definitely.
This one was 3 inches, again, 3 inches less than this one. Yeah. So that all tells me that this SI or sacroiliac joint is locked. So we're going to start by adjusting that. So I'm going to be placing a block under your pelvis here. This is to take out some of the rotation we saw. And then this knee, I'm going to place a block under your knee. And then the table's going to drop away. Good. And then we're just going to go up this way. Breathe in and out. Good. Okay. Now let's recheck. We're going to go back to flexion again. Relax. Good. And that's better. Do you feel the difference now?
Oh yeah. Yeah.
So now they're even, or if anything, the right's a little bit better than the left. Let's try the straight leg raise now. Raise the right leg as high. Oh, much better. Wow. Now the other one. Okay, so now the right one's higher than the left. So we need to work on the other side. Are you just going to feel a little hammering or tapping around the SI joint? Is that tender right on that spot right there?
Yeah.
Yeah. Okay, let's try this again. Good, much better. Does that feel less tension?
Oh yeah.
And now try your straight leg raise again. Good. Now the other one. Good. There you go. They're even.
Wow.
All right. Let's move on. Gonna go up. First, breathe in and breathe out. Good. All right. Next, I'm going to slide down this way. A little more. Good. You can let your arms hang inside here. Turn your head to the sides and lay it down. and we're going to see which side feels more difficult to lay, going that way or turning to this way. Which side feels more restricted?
This side.
This side?
Yeah.
Okay, back to center. Good. Let the head over to the side. Good. Good. There we go. How was that?
Good.
Now, as you can tell, the right side's really tight. So I'm just going to use the Theragun here. Is that tender there, James? And that's where you'll want to ice. And make sure you drink plenty of water today. You're going to be a little sore. Okay, so now let's recheck. Turn your head to the right again and lay it. And now turn your head to the left and see if they're even.
Yeah.
They're even now?
Easier.
Okay.
Yeah, this side's a little harder.
Still a little tighter? Okay.
Yeah.
Stay to the left. Good. Back to center. Okay. Turn your head to the right again. Now to the left and see if that's any change.
Yeah.
Yeah? Or would you say they're even now?
Yeah.
Okay, good. So this next adjustment is for the forward head posture. I'll need you to slide down a little more. So this is a special headrest here. This raises up. You're going to look up towards the wastebasket there. So that puts the curve in your neck, and this brings the head back. So right now your neck is anatomically correct, the way it should be. And I know that feels pretty weird, right?
Yeah.
You're not used to having your head back there. So now the table drops pretty fiercely here. We okay with that? All right. Good. And just stay like that. Okay. You're gonna feel just a little hammering here again. This is going to help bring the head back to the shoulders. Good, now we can put that down. Okay, so now take a deep breath. You should be able to breathe a little better now because your head's back. Does it feel like you can breathe? Take a deep breath. Feel more relaxed?
Oh yeah.
Good. Turn your head to the sides now. Lay it down on each side and see if that's better.
Yeah.
Still a little tension to the left?
Yeah.
I'm thinking what you're feeling there is this tight muscle in the trap right here. We'll work on that in just a minute. Okay, great. Turn over on your back. Now we're going to be doing your hip decompressions. Go ahead and lay on your back.
What do I do with my hands?
Hands right on your tummy. And now we'll be doing the hip decompression. So I'm going to be grabbing your leg here and just giving a little pull. This is going to decompress your hip, lower back. Good. Feel it?
Mm-hmm.
Relax. Oh,
Felt that one.
yeah, that was good. Okay. All right. Now what I'm going to have you do is sit up. I'd like you to spread your legs. Good. Sit up nice and straight. You're going to cross your arms on your chest. Good. All right. So basically we're going to be taking a deep breath in, and then you're going to take a breath out, and you're going to twist to the left. Okay, breath in, breath out. Good, twist. Here we go. Feel that?
Mm-hmm.
Now the other side. Breath out. How's that?
Yeah.
Take a deep breath. Feels good.
Mm-hmm.
Okay, now have a seat right over here. Put your right hand on your right hip. When I ask you to, I'd like you to try to pull your elbow back towards me, like that. Yeah, not yet. No. Okay. Good. Good. Now pull it back hard. There we go. Feel a pop.
Mm-hmm.
Good. I'm going to adjust the scapula. So with you spending so much time at the computer, you're getting a lot of stress on your shoulder, on these muscles. Relax the elbow. Good. All right, I'm going to adjust the wrist. Good. Thumb. Good. And the elbow. Relax. Good. All right. This side as well here. Can you take your watch off?
Yeah.
Good. Let's get the wrist. Good. Thumb. Good. Elbow. Whoa. Ha ha. Shoulder. Hand there. Elbow back. Elbow. Good. That side's okay. All right. How are we doing so far?
Good.
Good. Now we're going to be doing the Y-strap or Y-axis decompression. So this is where we're going to be opening up the spine, decompressing those discs that we saw in the x-ray. Sure. Lie on your back. Let your legs hang down. Okay, just let your legs hang. Hands go on your tubby here. So I'm going to place the Y-strap at the base of your head here. You're going to feel a little traction on the neck, a little stretch, and then a pull.
Just completely relax.
And just completely relax. You're probably going to hear several pops or cracks there in your neck. And don't get up right away, just lay there. Yeah, so you're going to feel a little stretch like that. Good. Breathe in. Good. Good. Another breath in. And now out. Okay, so stretch and pull. Good. What'd you feel?
Yeah, felt pops.
Was that more in your neck or upper back?
Neck.
Neck.
Base of my neck.
Okay, so just take a deep breath, and you see what I'm saying about the breathing?
Mm-hmm. Yeah, much easier through my nose.
Good. So now we're going to check your TMJ. So I'm going to have you open and close your mouth real wide, as high as you can. Okay. So I don't know if you can hear this, but his joint, you can see it clicking. Open and close a few times for our viewers there. You can see how that's clicking and popping there?
Mm-hmm.
All right. So let's adjust your jaw. I'm going to have you lie on your left side and face the window. You can slide down this way just a little. There you go. Chin up. Chin up. There you go. And then the table just drops gently like that, right on the jaw. So there it goes. Feel the pop?
Mm-hmm.
Do that 3 times just to make sure it's in place. But we actually got it on the first drop. Now we'll have you switch sides and face that way. Without rolling off. Slide down. Good. Look up just a little. Open and close. Oh yeah. All right. There it goes. We got a little bit of movement on that second drop and third drop.
Mm-hmm.
Okay. Now open wide. Better.
Wow.
It's not popping. Turn on your back and let's just show how the jaw's tracking down. Much better. You feel a difference there?
Yeah. No pop.
That's amazing. And you know, when your
There's
jaw
a
is
little
out, it
one,
can
but-
cause other symptoms like headaches. It can affect vision problems. It can cause dizziness, ringing in the ears. So there's a lot of symptoms of the TMJ that we don't realize that it's our jaw.
Yeah.
We end up going to all these different doctors one for the ringing and one for the loss of balance and another one for the blurred vision, and never get to the chiropractor for a jaw adjustment.
Mm-hmm.
Well, how are you feeling right now?
Much better.
Good. So what I'm going to have you do is stand up, and we're going to recheck your posture again. You might feel a little lightheaded after that. All right, so let's take a look. All right, so good. So I can see already that this shoulder's come back.
Mm-hmm.
The shoulders. And look at the spacing now. Look at the spacing now. Do you see the difference?
Mm-hmm.
How it's even? Remember before? How it was greater? Yeah. So that looks better. And turn and face the window, and let's take a look at the forward head posture. Now just put your head where it feels natural now. Okay, and immediately you can see his head's come back. So the back of his ear is now at the reference line. So that looks really good. And just stay like that, and I'll give you the mirror just so you can see for yourself. Hold this mirror in your left hand. Put your head where it feels normal, and then just look in the mirror at yourself. Look in this mirror. You might need to step back a little. Can you see yourself?
Yeah.
Keep your head looking towards me. Move the mirror. There you go. Can you see yourself from the side?
Oh, yeah.
Look how it's come back.
Yeah.
And put your right hand back there and feel the hump. Almost gone, right?
Yeah. That's amazing.
That's great. All right, so this was James's first adjustment, and we did his forward head posture, we did his left shoulder blade, his hip, his SI joint, and most importantly, and the biggest thing he's going to see improve is his TMJ. So, great. So how do you feel?
Thank you. Much better.
Much better.
Much appreciated.
Great.
This was awesome.
Thanks for watching. Be sure to subscribe to our channel and check out our website, ManitoChiro.com.